Welcome. These slides will walk you through how the measures in the panel reports are derived, timelines, and some considerations when viewing the report. The Health Quality Council of Alberta developed the primary healthcare panel reports to support physicians to better understand their patient panel and the care their patients receive. By presenting clinical data that is specific to the panel of patients you care for, the report helps physicians identify what matters to them. Let's get started. Two things help determine what measures are included in the panel report. The first is what family physicians care about, and the second is measures for which there is data available. The administrative data is from Alberta Health and Alberta Health Services, and includes data from sources such as physician billing activity and inpatient hospital use. The HQCA is a provincial custodian of data and has the legislated ability to access these sources of healthcare information. The data sources are administrative in nature and are not from your EMR. Administrative data allows us to look at how patients use the healthcare system inside and outside of your clinic walls. It includes information from items such as physician billing activity, hospital inpatient use, lab use, pharmaceuticals, diagnostic imaging, emergency department use, cancer screening, and vaccination data. It is a combination of both this administrative data set and your unique patient panel list that makes up the data you see in your personalized report. The measures in the panel report are derived from patient activity and the services patients use. The patient list used to build a panel report can be based on either a confirmed patient list or a proxy panel list. A confirmed patient list comes from you. It is a list of patients where the patient and the physician have agreed that this physician is their family physician and most responsible for their care. This list typically comes from your EMR. If you are participating in the CII-CPAR initiative, this list of patients will come from CPAR to the HQCA. Participating in the CII-CPAR initiative is the best way to validate and share your panel information with the HQCA. The proxy panel list comes from the HQCA. It is an estimate of your patient panel derived from the proxy algorithm. The proxy algorithm uses 3 years of physician claims data to link each patient who had a healthcare encounter to a family physician. The algorithm predicts which family physician from all those seen by the patient is most likely to be the patient's main family physician. Any patient that is assigned to a physician is a patient they billed for at least once in the last 3 years. It is a combination of the administrative health data set and your patient panel list that generates the information you see in your personalized panel report. The report is released in the first quarter of each calendar year and contains information from 1 year prior. While most data is from a year prior, certain measures, such as burden of illness and screening to name a couple, require a look back at historical data to capture a diagnosis or screening maneuver that may have been made more than a year ago. Continuity measures, for example, require a 3-year look back at patient visit patterns. Two important considerations as you review the data. There is a 1-year delay in the data in the report, and as the data is administrative in nature, the measures do not reflect team-based activity. So, for example, a visit your patient has with a diabetes educator in your clinic, where the patient does not see you, will not be captured in this data set. Thank you for watching this video. For more information related to the data, please visit hqca.ca/panel reports and navigate to the Understanding the Data section under Resources.